Good afternoon, everybody. Hello, thanks for joining us today. So today's cancer care virtual seminar topic is managing side effects of cancer treatment. My name is Carmen Boone, and I'm an outreach coordinator for the Samaritan Cancer Resource Center, and I will be your host and moderator today. This event is brought to you by the Samaritan Cancer Resource Center. We partnered with anyone touched by cancer to provide the support they need to live with the strength, determination, and hope in the future. Today, we have Dr. Herschel Wallen, and he'll be joining us today. He's a medical oncologist. So without further ado, here we go.
So I'm not sure how many people are on board at all, but I'm going to talk briefly about the side effects of various cancer treatments and kind of a very high-level overview. So some specifics, but mostly sort of mostly generalities and things that you can do at home. So next slide. So what is chemotherapy? Chemotherapy is it's a whole rubric that categorizes various treatments and medications, generally systemic treatment or treatment that affects your entire body, that interferes with cancer cells' growth and replication pattern, and ultimately with the target of destroying the cancer cells. Next slide. There are various types of chemotherapy. Some are oral, some are intravenous. The ones that you more commonly think of are intravenous that you receive in the infusion center, and they can last from very brief treatments that are like subcutaneous injections all the way to treatments that require many hours, sometimes even half or 6 hours. The time and the frequency also varies. Next slide. Immunotherapy is a different category that you may have heard about. Often we combine this with chemotherapy, but the goal is to activate your immune system. There's a variety of different immune therapy agents out there. Most of these are intravenous as well, and they have a different and more unique kind of side effect pattern than chemotherapy, but we can get into that later. Okay, next slide. And so the common side effects of chemotherapy are things you may have some familiar with: nausea, vomiting, diarrhea, constipation, mouth irritation or mouth sores, commonly called mucositis, neuropathy, which is generally a numbness in your distal extremities, but it also can be irritating and painful, very similar to diabetic neuropathy. Blood clots are also commonly occur during treatment for a variety of reasons. One is chemotherapy sometimes can predispose you to blood clots, but also your existing cancers also produce agents in your bloodstream that predispose folks to blood clots. So it's the combination typically that increases your risk. Alopecia or hair loss, and then the one that we commonly see and then we monitor in the clinic is reduced blood cell counts, typically white blood cells, but also can affect red blood cells and platelets. At home, you may notice more fatigue, and then we also worry about fever, and then there's other autoimmune effects can occur with immune therapy that we'll get into a little bit later. Next slide. So the one thing you may want to consider is that chemotherapy effects on folks are highly variable. Some people, depending on especially the dosing and the scheduling and their age and what we call their performance status or what their pre-chemotherapy functional status is, can weigh quite heavily on how tolerable the chemotherapy is. And so the side effects can vary tremendously. Even from person to person, if you've had the same chemotherapy maybe a couple years ago, can vary depending on your overall health, and certainly vary between people. Next slide. So the most common side effect is nausea. We recommend people use nausea medications, sit upright after eating, try to eat more smaller, more frequent meals if that's possible. Salty foods can be helpful for folks with nausea, mostly because they tend to be on the dehydrated side, and salt tends to improve people's thirst response. And then just getting out and getting fresh air and exercise and air blowing past people's faces sometimes can help with the nausea as well. Next slide. Vomiting. So if you have significant vomiting and it doesn't respond to the nausea medication, you should call the cancer clinic. But if you vomited up some of your nausea medications, and if it's within an hour, you can repeat your nausea medications. If it's more than an hour, you might want to wait to see if some of the nausea medications can start kicking in and working. All right, next slide, please. Mouth sores and mucositis are very common. It can occur in the mouth, on the lips, also can occur further down in your throat, and can be very irritating and painful, makes eating and drinking difficult. And there's a fungal infection called a thrush, which is usually manifested as white little patches on the tongue, upper palate, or throat area that can be treated with various medications, can also occur. Next slide, please. So prevention of mouth sores is always the preferable option. Frequent rinsing, we encourage folks to rinse with baking soda or salt water. Baking soda tends to be preferred by most people, but some people like just, salt water. Rinsing, gargling can be helpful. You can't get way down into your throat with gargling, but you'll be surprised on how far the gargle can affect your throat. Avoiding alcohol-containing mouthwashes, drinking lots of fluids, and then removing the dentures as well. Okay, and if that doesn't work, there's also various medications being used for mouth sores and mucositis, particularly numbing medications. Next slide. So again, soft foods, yogurts, broths, milkshakes, depending on people's lactose intolerance. And if that doesn't work, then there's numbing medications that usually contain lidocaine, which can be helpful, although they tend to be very transient, 5 to 10 minutes. So the mainstay of treatment is really the rinsing with baking soda or salt water, because you can do that, every 5 minutes to every hour if needed, and that tends to help with the pain as well. Okay, next slide. So from a hematology point of view, we monitor your blood counts carefully. So just as a way of review, red blood cells carry oxygen, the white blood cells fight infections, and the platelets are needed to help you from stop bleeding. Next slide. So after chemotherapy, typically 7 to 10 days after chemotherapy, folks' blood cell counts take a what we call the nadir, or the low point in your white cell count, and then it takes some time for your body to recover those cells. So we check blood work frequently before every treatment, and if the blood work shows that the white cell count is too low, or potentially the platelet count is too low, we may have to delay some of your treatment and just push that out a week or two. Okay, next slide, please. So white blood cell counts, we monitor them frequently. If the white blood cell count's too low, then you're predisposed to having infections. Particularly if you have a fever greater than 38.1 degrees or 100 degrees for over an hour, you should let us know, because typically we'll give you antibiotics or send you to the ER, the closest ER if possible. Other concerning symptoms, if you start having chills, typically chills are an indicator of some sort of immune activation. Now that can be related to immunotherapy, but it also could be your immune system's activated because you have a systemic infection of some sort. So, and then cough and sore throat can be an indicator of some sort of infection, as well as potentially pneumonias. Next slide. So if you have low white cell counts, the recommended precautions are limit contact with people, particularly if they're ill, wash hands frequently, rest, try to maintain, some level of walking if you can. That helps for a variety of different reasons. Prevention of blood clots for one thing. And then if the white cell count's very low, we may give a white blood cell growth factor, such as Udenica or Neulasta or something. And these tend to work very well. However, the most common symptom of these white blood cell growth factors are bone pain, because they stimulate your bone marrow to make more white cells. So sometimes folks actually do quite well with the chemotherapy, and their worst side effect is the growth factor, because it causes bone discomfort, usually about 5 to 7 days after the white cell injection. But some people have very minimal symptoms from the growth factor, so it's highly variable again. Next slide, please. So if you do have a fever and it's over 100 degrees for longer than an hour, you should call the cancer center, and we'll probably redirect you to the nearest ED. There are some occasions where we can, try to manage this as an outpatient with oral antibiotics in people who we think probably at low risk for, very serious complications. But generally, we end up sending folks to the ED if you have a fever, and they may admit you into the hospital for intravenous antibiotics if your white cell count's very low while you have a fever. So yeah, and in general, you shouldn't medicate with Tylenol or Advil because it can mask the symptoms of a fever. Now, the one caveat to that is that if low-grade flu-like symptoms, including fevers, can occur with immunotherapy within the first few days. So people can have low-grade temperatures within the first few days of treatment, and they're not in that window yet where their white blood cell count would be low, because that usually occurs more like 7 to 10 days after chemotherapy. So if it's just like the day or two after your chemotherapy and you have a fever, that's probably not your white cell count, predisposing to infection. It's more or less, that's more likely just an impact on your immune system, sort of really revving up. And there are some times where certain chemotherapies can cause flu-like symptom within 24 hours of the administration of the drug, and that's a sort of, in fact, it's not patient-related, an infection-related complication. So, okay, managing low, so if your platelet counts are low, generally we just do conservative measures like, use a soft toothbrush, be careful with bleeding, try to avoid physical activities that can cause a lot of bleeding injuries, avoiding aspirin or aspirin-containing agents. But generally, low platelet counts can recover fairly quickly. It just needs a little bit more time. Okay, next slide, please. Occasionally, folks also have a low red cell count. Red blood cells cells are important for carrying oxygen to your tissue. So if they're quite low, they can cause breathing problems, exacerbation of congestive heart failure, fatigue, dizziness. In those cases, we may administer a blood transfusion. Okay, next slide, please. Fatigue. So the fatigue is probably the most common side effect from chemotherapy, and it's a challenging one mostly because people have baseline level of fatigue for a variety of different causes. Their predisposing malignancy will do that, and they tend to have other comorbidities that cause them to have fatigue, and so it's maybe exacerbated by ongoing chemotherapy treatment. Next slide, please. What we recommend is to try to pace yourself, plan rest periods, but try to do your normal activities as much as possible, and if possible, do a little bit of some form of exertional activity like walking or something, because too much rest can be in ways debilitating too, because you just sort of go down a slippery slope of resting, and you get deconditioned in general. So next slide. So if you can, short, regular exercise can be helpful, and this has been shown in a number of studies. Folks who are going through chemotherapy, if they do a scheduled exercise program, actually have less fatigue in general. Drink plenty of fluids, and then eat high-quality foods. Okay, next slide. Some helpful hints about managing the fatigue. Yeah. Okay, next slide. So other common targets for chemotherapy are the gastrointestinal tract, because those are rapidly dividing areas in your body, particularly the mouth can cause, so irritation there can cause mucositis, so you can get esophagitis or irritation of the esophagus. Usually there's chest pain or heartburn kind of symptoms. Sometimes people get gastritis or stomach irritation, and antacids can help with that. And then effects on the intestinal system are usually manifested as diarrhea. And there are all kinds of conservative measures for managing diarrhea as well. Okay, next slide. So So diarrhea, more than 4 to 6 loose bowel movements a day, lasting more than 1 to 2 days. If you have severe diarrhea, you should notify us. We'll more than likely give you anti-motility agents or anti-diarrheal agents. If it's related to immunotherapy, if we think that your diarrhea is related to immunotherapy, then we may give you corticosteroids like prednisone to quiet the immune response as well. So usually a combined approach for significant diarrhea. Next slide. Constipation is the other direction. There's all kinds of laxatives, stool softeners, pro-motility agents that we can use. And then, of course, encourage you to use or eat a lot of bulky, fibrous products as well. And fluids, just maintaining your fluid balance. Next slide. Alopecia or hair loss. Depending on the type of chemotherapy, you can result in hair loss. So avoid using hair blowers and curling irons and anything harsh on your hair. Next slide. Usually occurs a couple weeks. Sometimes it doesn't occur until the second or even third round or cycle of chemotherapy. So it can be somewhat delayed. It'll eventually grow back, but may be a different color or texture. Okay, next slide. And we can always give you prosthetic devices for your hair as well. Next slide. There can be hormonal changes, particularly with premenopausal women with chemotherapy can induce a kind of like perimenopausal state, which can be transient or in some cases can be permanent, depending on your age. Can also cause irregularities in menstrual cycle, and again, you can induce kind of a perimenopausal state with mood swings, hot flashes, vaginal dryness, etc. Okay, next slide. You should avoid pregnancy while on treatment, of course. Yeah, if you have any questions, you can call us. All right, next slide. During the summer, there are particular chemotherapy agents such as 5-FU or Xeloda that can increase your risk for sunburning, and we've seen a couple of folks that have really bad sunburns during the summer because they've forgotten to wear a hat or something like that. So in general, use sunscreen, make sure you wear your hats, and sunglasses, of course. Okay, next slide. The other vexing side effect for some chemotherapy agents is neuropathy, which is a numbness or tingling in the hands and feet. Depends on the type of chemotherapy. The taxanes, such as Taxol, are notorious for causing neuropathy. And neuropathy can be particularly vexing just because it can last for quite a long time. Sometimes they're reversible, sometimes they're not. Some people have baseline neuropathy from other disorders such as diabetes, which can be exacerbated during treatment. So it's a chronic issue, and we deal with it on an individual basis. There are medications for neuropathy that can be helpful sometimes. Gabapentin or Lyrica are commonly used. Sometimes we use topical tricyclic agents like Elavil, and sometimes there are topical agents. Some people I have known recently have used a combination of topical like frankincense and myrrh, which I think folks can buy at their local drugstore, which seem to help at least transiently. So yeah, so all kinds of multimodality methods of trying to address a neuropathy, and it can improve, but it does take time. But yeah, okay. Next slide, please. The other thing that we commonly hear is that chemotherapy causes kind of a brain fog or mental fuzziness, short-term memory lapses. And this is also very idiosyncratic. So recommend sort of the workaround would be making more notes, writing things down, maintaining a routine, and then learning some relaxation techniques to try to minimize some of the sort of multitasking that folks have to do. Other things that are helpful are just doing your daily walking and exercise. There have been a number of studies just showing that even some light exercise can really improve the sort of sensation of memory issues during chemotherapy. Next slide. DVTs or blood clots are also possible with chemotherapy because of the predisposing issue with their malignancy, as well as chemotherapy oftentimes can increase your risk. So things to watch out for are if you have a unilateral swollen calf or forearm, or if you have sudden chest pain accompanied with shortness of breath. If this occurs, you should call us, but commonly we will, or typically we will send you to the nearest ED department so they could evaluate that with typically an ultrasound or CT scan to see if to rule out the possibility of a blood clot. Next slide, please. And in general, we recommend trying to minimize your use of alcohol while on treatment. Chemotherapy can interact with lots of different medications, so trying to look at your medication list and see if there's other medications that we can try to minimize. Oftentimes, I'll adjust people's blood pressure medications because some chemotherapy medications interact with them, or reduce their diuretics because chemotherapy can commonly cause people to drink less and with the nausea, and so they may not need as much of the water pills or diuretics as they typically use. Next slide, please. Yeah, and exercise, is important on a variety of different levels. It can help with your mood. It can help with the sort of brain fogging effect. It can help with your energy level, and sometimes even nausea. And so it's, yeah, in general, if you can maintain some form of daily activity, it's very helpful. Next slide, please. And on a day of chemotherapy, we suggest eating, sort of a low-fat breakfast, just in case you have problems with nausea. You should be receiving nausea medications as part of the pre-medication for your chemotherapy on your infusion day, but not having a really full stomach, of course, helps. And then bring in any prescription medications that you would normally take on that day. All right, next slide. So in summary, being diagnosed with difficult things you'll ever have to face, as you well know. It's not unusual to experience a variety of different emotions. People go through the gamut of emotions, and you never know what you're going to find on that particular day. If you feel like these are interfering with your ability to cope, we do have, mention it to us as well as our social workers, and we can see how we can address these. But yeah, it's often helpful to express yourself, and every day is different. Okay, next slide. I think we could probably skip. There's some nausea medications listed: steroids, dexamethasone, ondansetron, and olanzapine. We're using olanzapine more commonly now than we used to, but sometimes the nausea medications will have you start actually the night before your chemotherapy at home. Okay, next slide. Other nausea medications, and we can skip this. That's right. We'll too. Next slide, please. Oh, one last thing I wanted to mention is that please mention to us if you're taking any holistic, herbal, or natural supplements. Some of them may interfere with chemotherapy by reducing effectiveness, but it's also just really helpful to know what people are taking, because that may affect their tolerance and as well. So, okay, next slide, please. All right, I guess that's it. All right, great. You guys have anyone have any questions?
So thank you, Dr. Wallen, for all what you shared with us. Now we will give our participants a few moments to write any question and comments in the questions menu if you didn't write one before. We'll appreciate it. While participants are entering their questions, we'll go over some contact information and information about upcoming events. If you would like to obtain more information or resources about cancer, feel free to contact the Cancer Resource Center by phone, email, or visit our website or social media. If you are interested in receiving our newsletter or subscribing to any upcoming events, please contact us. Now, let's see what we have coming up. We will be having two events, one in September and the first one coming up in October. Metastatic prostate cancer on Thursday, September 15 at noon, and metastatic breast cancer Thursday, October 6 at noon. So if you're interested in joining an upcoming cancer care virtual seminar, please contact us. Now, let's go over your questions. So, are your offices open 24/7, or is there an on-call doctor?
Our office, I believe, is open like 8:30 to 5 o'clock, and then after hours, there's an on-call person. It's for outpatient calls.
All right. I got another one. Please discuss the possible long-term side effects of targeted high-dose radiation.
Well, this is a little bit out of my scope in terms of high-dose radiation. It also depends on the location. So, I mean, for one common example, I don't know what you refer directly to, but there's something called SBRT, which is high-dose radiation to a very focal area. So it's kind of like very focal spot welding that the radiation oncologist will do. And that's generally extremely well tolerated with fairly minimal side effects. I think you can cause scarring in that area, but I don't know of any other significant long-term side effects. But again, probably would ask the radiation folks. I don't think there's any significant long-term side effects, but it depends on where they're radiating. So if they get close to any specific organs, then you have to watch out for those areas. But generally, they wouldn't give high-dose radiation if they felt like there was significant organ risk.
All right, thank you. Do you have certified nutritionists on the staff? I can answer this one really quick. We do have certified nutritionists, and if you contact the Cancer Resource Center, we'll be happy to connect you with them. There's another question again about the Cancer Resource Center hours of operation. We are open from 8 to 4, but if you have any questions, you feel free to give us a call and leave us a message or send us an email. What resources does the CRC or Cancer Resource Center offers? So we offer a variety of services. Some of them include our library that you can visit at any time and read on our center or borrow books until you're done with them. We also have wigs for our patients, hats, scarves, and a variety of products for our cancer patients. Additionally, we offer these educational events and support groups for different populations like young adults and different cancer types. Also, we have social workers, dietitians, and we offer support to all our patients. So if you ever find yourself with a need or something that you don't know where to go or who to ask for, feel free to reach us and we can connect you with the right resource. I'm gonna ask my colleague, my partner coordinator, Annie Gabby, to complete anything that I may have missed. Annie, can you tell us?
You covered a lot of it. Another thing I would mention, our financial assistant, just to elaborate a little bit, Candy is available to any patient that has questions regarding payment or bills or understanding insurance information. She can make an appointment with you to go over anything in depth. So if you need help connecting with her, please reach out to us. We also have a fitness program called Survivor Fit, which offers 3 free months of gym membership at one of the SamFit locations or partnering fitness locations across all 3 of our counties. So if you need any help getting registered for any of those services or have other random questions, please reach out to us. We'd be happy to figure those out and connect you with the right people.
Yep, the financial assistance is very important. Another question just came in asking if we offer services in other languages, and the answer is yes. We have interpreters and that we can get for any languages. And I'm a Spanish-speaking coordinator and resource navigator. So yes, we do have languages offering. So yeah, whatever you have a need or a concern, we are here to help connect you with the right resource. How many different kinds of brands, manufacturers of the tamoxifen? What are the differences between the different formulations as it relates to side effects?
I didn't quite get that. What was?
So it says how many different kinds of brands or manufacturers of tamoxifen are there? Tamofaxin. Tamoxifen.
Yeah, I think there are at least 3. You know, some people generally prescribe tamoxifen. The pharmacist at your local pharmacy will give you the generic version. And for some reason, and I'm not sure why, some people like a specific brand type of tamoxifen because they tolerate it better, and so then we go through that particular manufacturer. Some people feel like they maybe have a little bit less nausea, but it's just I don't think in general there's significant differences between the manufacturers of tamoxifen, but there are a few people who do notice a difference and will just order from that specific manufacturer.
Okay, so there are no differences between the different formulations?
It shouldn't, no, not chemically. You know what I mean?
Okay.
It's kind of like, it's probably like buying different types of toilet paper. Some people just have a preference.
Gotcha. There's another question about the same medicine. It says it's been around since the 70s. Why do all women get 20 milligrams? Is it because?
Well, that's the standard dose that's been studied the most. Now, recently, depending on what type of breast pre-malignancy, so there's pre-malignant versions of breast, not cancer, but pre-malignant conditions. And recently, we've started using lower doses if you have something called ADH or LCIS or DCIS, which are all pre-malignant conditions. There's some data suggesting that lower doses of tamoxifen, like even 5 milligrams, can be helpful. So it varies depending on, but 20 milligrams is the standard dose used if you have an invasive disease, because that's the one that's most. Sometimes we will reduce the dose if somebody has, significant side effects to that dose.
Thank you. And they also ask about the inner materials on tamoxifen and if there's a difference between different formulations for brands. Okay, I'm unmuting the participant and see if she can ask the question. Hello, Julie?
Hi, doctor. I'm Julie. I'm out of Minnesota. I was just really curious about this tamoxifen, especially, since it's been around so long, and all women get 20 milligrams, regardless of their type of cancer, their age, their health, their weight. If they have a low, like on the Oncos type scoring that they do now, if their score is a low one or a high one, it's meant to reduce the risk of reoccurrence and to block, any potential cancer cells, from getting any estrogen attaching. If you have a really low risk score, why wouldn't a 10 milligram or 5 milligram be warranted versus a 20 milligram of somebody that, has more of an aggressive cancer, that's, just not, and it's so much farther along.
Let me answer in a couple of ways. The oncotype is not used, is not intended to try to, it's never been studied on dosing, relative to dosing of estrogen blocking agents like tamoxifen. The oncotype is used to determine whether chemotherapy would be helpful or not. So that's a different, and it's never been studied in the tamoxifen.
Okay. Good clarification, thank you.
The second answer is that tamoxifen for invasive breast cancer has only been studied at the 20 milligram dose, Now, for non-invasive breast cancer, it's been studied at other doses. But for I'm assuming you have invasive breast cancer.
Correct.
For invasive disease, 20 milligrams is a standard dose because that's what all the studies have used.
Okay. Because I have like a really low score of 9, and then I found out with my actual pathology from my, double mastectomy that my invasive was not actually ductal, it was tubular, which is even a less aggressive. So I'm just questioning the 20 milligram dosage.
Yeah, that's
been around for so long. Why haven't they
no one studied
tested
lower
dosages with, less risky or less invasive cancers or,
Yeah, well, the answer is we just don't know. I think, you negotiate with your oncologist, different dosing, but we just don't have evidence that it would be helpful at a lower dose for invasive disease. So for your specific, subtype, nobody knows. And I think if you wanted to rely upon evidence-based medicine, you would still do the 20 milligram dosing. Outside of that, we just don't have evidence, in that setting.
Okay, thank you so much, Dr. Wallen, and thank you so much, Julie. She's asking why has nobody asked asked after all these years? But I think that's just
a lot of questions in medicine we just don't have answers to. Somebody would do a large-scale study, and there's probably not a lot of motivation from. Certainly, tamoxifen manufacturers aren't interested in doing those studies anymore.
Yeah, maybe more direct answers from the FDA that authorized that medication. I don't know, right?
The FDA bases it upon, you have to do a clinical trial. The FDA just reacts to whatever, information's out there. And so someone's got to be willing to do the study, and, that hasn't been done. It's not outside the possibility that you still have benefit from a lower dose. We just don't know.
Perfect. Thank you so much, Dr. Wallen. Answer any questions afterwards. If you send it to the Cancer Resource Center, we'll make sure that we send that question to Dr. Wallen. And if you also have questions that prefer to be answered privately, same. Our email is cancerresourcecenters@samhealth.org. And thank you so much for being with us today. And finally, thanks to all of you for participating with us today, and thanks to Dr. Wallen for sharing your knowledge with us and time. And everybody, have a great day. Please fill in the survey that will open at the end after the webinar has concluded. Thank you so much. Goodbye.